Hi everybody, Lou Bernardi back from BrightPath. Today I want to talk to you about the ABCs of health insurance. This is a quick overview for benefit decision makers, HR leaders out there, so that you can better understand what's happening within your health insurance plan. Because one of the things that we're really focused on is taking the focus off the health insurance and onto the health care, the quality and the cost of health care and benefits that your employees are getting out of the plan. So we have 4 buckets here. The first bucket is the medical claims, the medical costs of your plan. And if you're an employer with 100 or more members on your health insurance plan, you're typically going to be experience rated. So this is especially important for you guys to understand. Medical claims, you've seen that on your renewals. Pharmacy claims, RX, pharmacy claims, all the administrative fees. And then we'll talk about the 4th component, which is in the waste. And this is really where we want to educate our employers. But pretty straightforward. Medical claims is going to be the cost of claims for your doctor's visits, facilities. Those are the labs, radiologists, urgent care, inpatient and outpatient costs, medications that are administered or delivered at a medical setting, hospital, inpatient, outpatient, doctor's office, injectable medications, cancer medications, things like that, can be very costly medications. The total of all of those claims, those expected claims, plus 20%, especially if you're fully insured, they're going to take the expected claims and they're going to add 20% to it, and that's going to give you bucket A. I'm going to call that A. Pharmacy claims, pretty straightforward. You have the cost of prescriptions that are delivered to your members by mail order or at a retail pharmacy typically. Same thing, cost of all of those prescriptions plus 20%, because if you're fully insured, your insurance company is taking all the risk, so they build that cushion. So those are your claim costs. And then you have your admin fees. Commissions, pretty straightforward, typically a percentage of premium. So it's kind of a combination of all of these at the end of the day. Retention, your insurance company adds the 20%, but that's not where their potential profit is. They build in another layer of retention, administrative fees. Could be 10%, could be 15%. We've seen some crazy numbers. They might as well throw it out there, especially if you have a broker or a plan sponsor that doesn't understand all of these numbers that are on the financial exhibit of their renewal. They'll take what they can get. So they'll start high, and usually that's where some of the negotiating comes from. But they want to make a profit. Pooling charges. Pooling charges are the charges for your high-cost claimants. So on a fully insured plan, you're going to have a pooling level. It might be $100,000, could be less, could be a little bit more depending on the size of your organization. But claimants, your claimants that the claims costs exceed the pooling limit, they're going to take that amount that's above the pooling limit out of your medical spend, which sounds great. Everybody thinks that's where it ends. But then they add it back in as a pooling charge. And typically, you're paying a lot more than that claim. We've seen pooling levels of $100,000 with a claimant of $200,000. So they'll take the $100,000 out there, but when they use their creative math and they put it back in, they're charging you $400,000 for that potential risk on that member. So that is really something that you need to be aware of. Taxes, of course, bonuses that are built in for brokers, agents, general agents, things of that nature. So that's a not complete list, but this is A, B, and C. Okay? A lot of people are under the misconception that they're getting the best prices from their health insurance company, that they're negotiating the best rates, that they're getting the best discounts. And I can tell you, discounts don't exist anymore. There's discounts, but they're discounts on artificially inflated rates. So forget that they even exist. So one of the things that we do at BrightPath, and this is really where we try to excel and educate our members, is eliminating these artificial costs from the plan. In the medical plan alone, you have things called upcoding, unnecessary care, steerage of the healthcare system, medication costs, because a lot of medications, as I mentioned, are here, and they are excessive, a lot more than the actual cost of the medication. And then you have trend, that of course, they take all of these things and they say next year it's going to be more expensive. So these are some of the things that we're looking to eliminate. We can eliminate a substantial amount of that medical claim, not by siphoning care, by just eliminating these upcoding, for example. Upcoding are just incorrect billing. About 60% of all claims, according to Slingshot Bills, a company that I had on my podcast not too long ago, 60% of claims are incorrect because they're billing for services they didn't perform, or they're billing at a level that was actually more than what the severity level of what the provider performed. We can get those, we can eliminate them. We can educate members so that we're getting them to the best doctors, and we can bypass that steerage of the healthcare system that always wants to upsell everything. We don't want you and your members paying $3,000 for an MRI unnecessarily at a hospital location when you can have a equally high quality MRI at an independent facility for a third the price or even less. Really, one of the things that's the easiest thing to do is just eliminate all the waste within the pharmacy. Not a lot here, but there's a lot of waste here. Huge Department of Justice investigation going on right now regarding pharmacy benefit manager practices that include rebates, spread pricing, and manipulation of the drug formulary or that drug list in order to create a significant amount of waste. Rebates are essentially coupons. The manufacturers have agreements with the pharmacy benefit managers. You're paying through your insurance company sometimes 100% inflated rate, $20,000 a month for a $10,000 medication. You pay it, they charge you for it. They even have the audacity to even build in a cushion on top of that artificial price, and behind the scenes they get a $10,000 rebate. You need to be aware of that. You need to be able to eliminate that from your health insurance plan. Spread pricing on generic drugs is a huge problem as well. As much as a 5,000% markup on $2, $3 medications, $5 medications, they're charging 30, 40, 50% or 50 times that medication's cost. You're paying $100 for a $2 medication. You need to be aware of that. Part of it, or a large part of what's happening behind the scenes in this waste, is the limited amount of actionable data that employers get on their plan. You don't get detailed claims reports typically. You see totals. You'll see, and we had an example, I'll give you a quick example. We had a client that had 3.4 million in medical claims the year before we transitioned them. They had $600,000 in pharmacy claims. We were able to do an analysis, getting some information, and we knew that we could do significantly better. The target or the analysis showed that we might be able to save them as much as 50% on that pharmacy cost. So after the first year, this was dropped by $600,000. We didn't change benefits at all. We just used better partners to eliminate some of these things. $600,000 savings, $300,000 savings on the pharmacy. It was actually $305,000, so just under, maybe 48%. But there was another $60,000 in rebates. So we took that pharmacy spend from $600,000 down to $240,000 roughly on that plan. So that's a significant savings. That was a savings of as much as about $900,000 if I do the math really quickly. And this was real money for this employer or veterinary system in New Jersey. They took that money, they enhanced their benefits, they purchased additional benefits very quickly. They saw the savings immediately, and they knew this was going to be a great thing. They wanted to give back to their employees. They were able to give back in bonuses, they were able to give back in salaries, and they were able to enhance their benefits to make themselves that employer of choice in their marketplace and grow the business even more. So hopefully that was helpful. You know where to reach me, and have a great day. Thank you.